and that's what winds up killing you. So if you have a valve defect, the reason you want to get it fixed is, first of all, simply to make you feel better. Okay? 'Cause people have a valve defect, they usually either are having a very poor time oxygenating their blood, or they're just not getting much cardiac output. That puts stress on the heart because the heart tries to beat faster to compensate for that. But the real danger is clot formation. Okay? You get poor flow through the heart, and then you get a lot of clot formation. Anybody in here have a relative or a family member that's had a valve replacement?
No, not a
No?
valve
Oh,
replacement.
what were you gonna say?
I had a question about the murmurs. Like,
Oh, yeah, go ahead.
are they all to the same degree? Because I have a friend who has a murmur and she's perfectly fine.
No. So good question. She said, are all murmurs as serious as others? And no, the answer is no. I have a heart murmur. I've had it since I was a kid. Heart murmurs are always abnormal heart sounds, and they're pretty much always the result of turbulent flow through the heart. However, there are congenital abnormalities within the heart that can cause a murmur. You know, if the blood is not flowing in a particularly laminar fashion through the heart, it's going to make some noise, and you're going to hear that. Okay. In my case, I probably have a congenital defect. I probably have some weird malformation in my ventricle wall that's making the heart, make a little noise when it beats. But it's always done that. So in my case, I guess I'm not too worried about it. My cardiac output seems to be fine. I think the problem is if you have a murmur, like if a doctor diagnoses you with a murmur, the first question they're going to ask you is, have you ever been told you have a murmur before? Okay, and if the answer is yes, then they're going to be less worried about it. Okay, if it's new, they're going to want to keep track of it, to see if it progresses or changes, and then they're going to see if you have any symptoms. Do you have poor pallor? Is there anything else to look at? And if there is, then you may wind up getting an echocardiogram where they actually look at the blood flow through the heart to see. Okay, so you understand S1, S2, early and late, what that means?
I have a quick question.
Yeah, go ahead.
You said for systolic pressure, that's when the ventricles contract, push the blood up, and then what was the diastolic pressure?
So diastolic pressure is what you have when the ventricles are relaxing, and it's the arteries pushing on the blood.
Okay.
The elastic arteries are what are responsible for establishing diastolic pressure. Okay. All right, so before I leave the idea of the valves, let me just give you a few more terms you should know. We know what an incompetent valve is, right? It's one that's not functioning correctly. The easiest type of incompetent valve to understand is a prolapsed valve, one that's folding backwards. Okay. Valves can also become abnormally hardened. They can become very rigid. Valves, as you'll see when you get to dissect the pig heart, you'll be amazed at how flappy these valves are. And you're going to look at them, you're going to think, how could that hold anything back? But they're very fibrous. But they're soft and pliable, and to give you an idea here, guys, we've all opened and closed car doors, and if you ever look closely, when you close a car door, there's a rubber seal that goes around when you close that car door. And if you get a really airtight car, sometimes when you close the door quickly, you even hear the air rush around it. Okay, it makes pretty much an airtight seal. That rubber seal has got to be soft. When the car gets to be 25, 30 years old, something like that, that rubber starts to become harder. Okay, and it doesn't seal very good anymore. And now you start hearing noise and stuff like that because the air is leaking around it because it's not sealing very well. Same thing with like a jar lid or something like that. As that little rubber gasket in there starts to dry out and get harder, it doesn't seal very well. Same thing with your heart valves. As we age, one of the things that happens is our connective tissues tend to become a little bit more fibrotic, and that means they become a little bit harder and less flexible. And it's not uncommon to have calcium deposits on some of our connective tissues. And it's fairly common to have calcium deposits on your valves. And when that happens, they become hard, like bone. Right? You've all seen this around maybe a sink or a faucet or something like that, especially in homes where they have hard water. You tend to get these calcium deposits around the faucets, and it's like a white crust. Okay. Well, that same kind of deposit can form on the heart valves, and it makes the heart valves become hard. And at that point, we call them a stenosed valve. Stenosed. S-T-N-O-S. A stenosed. O-S-E-D. Stenosed. Okay. I'll try. Stenosed. S-T-E-N-O-S-E-D. Stenosed. Okay. And that means the valves become hardened, and then it doesn't seal properly when it closes, and that's another type of incompetent valve. And probably the third type, most common type of incompetent valve is a valve that has simply deteriorated, a deteriorated valve. That is usually the result of a bacterial infection. Most commonly streptococcal bacteria infection, streptococcus.
What kind of valve?
Deteriorated valve. How many people have had dental work done? Okay, all right, all right. If you have a filling, it usually involves some drilling in the mouth, okay? Of all of my various health problems, I'm very blessed to have good teeth. My entire life I've had one tiny little filling. I'm very, very lucky. My wife, on the other hand, her teeth are like all full of metal. And she brushes and flosses way better than I do. So it's just totally genetic. So when you have your teeth worked on, they have to drill in there, right? Okay. And when that happens, there's always some bleeding. Okay. Well, your mouth, for some of you, I know you've taken micro or you're taking it now, you'll learn about your normal flora. And our mouth is a very dirty place. It's full of lots of bacteria. For the most part, they don't cause us any problem because they are adapted to living in the mouth. But when we drill in there, we can let some of those bacteria get into our bloodstream. And for whatever reason, streptococcal species that live in our mouth, they like to live in the blood when they get in there. And they like to set up shop and live on our heart valves. Okay? And so the leading cause of heart malformation, not heart malformation, but heart valve deterioration is complications from streptococcal infections from dental work. Okay? So this is why if you have fillings and stuff like that, usually the dentist will prescribe a prophylactic antibiotic. Okay? And you sit there and think, I feel fine, why do I have to take the stupid antibiotic? And it's to prevent this, okay? To try to kill off any bacteria that might get into your bloodstream so they don't colonize your heart valves. And then 5-10 years later, you'll wind up having heart failure as a result of not taking your antibiotics after getting a filling. Okay? And it happens fairly often. And it's such a slow process that people don't, really realize the immediate danger. Okay? But it can happen. And it happens at a fairly high rate. So if you do have extensive oral surgery and they give you the antibiotics, take them. Okay? And that's what you're protecting against. Okay? So what happens is the bacteria set up shop, they live on that valve, and they produce acids and things that make it deteriorate over time, and then it fails. And then you can start to actually organize a clot on it too.
Is there tests that doctors do to check for that?
The only test I can imagine them being able to do, well, I mean, they could take a blood draw and check to see if there's any bacteria in your blood. That can be done. I don't know how sensitive that is or how expensive that would be. I mean, I wouldn't probably go in and just have it checked just to see. And then really the only other test I can think of is an angiogram where they actually inject dye and they look at the blood flow through the heart. They can see the valves. What they can see is they can see whether or not the blood is regurgitating. And if they can see that, then they know there's something wrong. But at that point, the damage is done. At that point, the valve would already be malfunctioning. I've seen pictures where you can see a shadow of a big clot stuck to a valve. So that in some cases that can be done. But I would think the only reason they would do something like that is if you were having symptoms. It would, and that's why it's insidious, because you don't know what's happening until it's progressed pretty far along. Okay, enough about valves. All right. Apparently my computer thinks so too. That's a sure sign I've been on the slide too long. All right, we go through lots of structural stuff in part A. Talks about these valves again. Another picture of the valves, more valves. There's a valve on the inside showing the papillary muscle and the chordae tendineae. Okay. There's a section here where it talks about pathway of blood through the heart. You've already done that. Another picture of the heart. Out of the truck. Then it goes through and it shows you some pictures of the different coronary arteries. So this is what we've been doing in lab, so I'm not going to lecture on this. Okay? Other than maybe to point out this. Okay? So over here, this is a kind of semi-transparent picture. So here's the pulmonary trunk. There's the left coronary artery. Here's the right coronary artery traveling through the sulcus. Here's the anterior ventricular artery. There's the circumflex going around. Well, look here. Here's the circumflex leading back here, and it's going to come into the anterior or the posterior ventricular artery. So what is this little network called? Well, there's our name for it right there. There's our anastomosis. Okay, so that's an anastomose. That's an arterial anastomose. And here's another one. They're showing another one down here. This is the anterior ventricular artery meeting the posterior ventricular artery. So the reason the heart has that kind of stuff is for collateral circulation. So if you have a blockage in one artery, you can still get to that area via another route. There are two places that we'll see a lot of anastomosis. One is here in the heart, the other one is in the brain. Okay. There are some important anastomosis in the brain, so that if we get one cerebral blood vessel blocked, we may still be able to get there via a different route. There are a lot of pictures showing that. Now I want to get down here to tissue stuff. Oh, if you don't know this term, you should probably know that a myocardial infarction is the correct name for a heart attack. It's called MI, myocardial infarction. Infarcted tissue is ischemic tissue. It is tissue that has been deprived of oxygen. And so that tissue dies. And it says here that when it heals as non-productive, non-conductive, and non-contractile scar tissue. And that's true most of the time. Most of the time, once you have cardiac myocytes damaged, they don't regrow. But we know now that there are stem cells in the heart, and that some people are good healers. Okay, I have an uncle who's probably near 80 now. Maybe 10, 15 years ago, he had a pretty massive heart attack, and they thought he was just going to be, kind of like weak as a kitten forever, and probably need a heart transplant at some point. It was that bad. It was a really major heart attack. He survived it, but they really thought his heart was irreparably damaged. Well, guess what? His heart pretty much completely healed. It just regrew. It was back. Yeah, he's fine. He doesn't have any cardiac restrictions at all. Yeah, it's amazing, and there's not, I don't know of any real predictors, but he's what you'd call a good healer. It just healed, and that happens in some individuals, and there's really no rhyme or reason to it. What we do know about